Hi, welcome to another video from the CTAD channel. My name's Dr. Mike Lloyd. I'm the director of the channel. And today I'm doing something a little bit unusual. So we're going to be doing an interview. One of the last videos that I put on was around autism and dissociation. And I have to admit, there was a lot of things that are out there in the world that I didn't really know about this subject. And it was absolutely wonderful to receive an email from this person called Katherine, who contacted me from the United States and said, here's a load of stuff that I know about this subject. And I thought, instead of me just trying to write it all down, it would be better to get Katherine on an interview for the channel and see whether or not she'd be willing to come and talk to us all about all the stuff that she knows about autism and dissociation. And thankfully, Katherine said yes, and she is with us now, so you'll be able to see her on the screen. So I'm going to just jump in and start asking Katherine some questions about herself and her work and her interest in this field. So, Katherine, this is all about autism and dissociation. Can you give us a little bit of background as to yourself and why this field is of interest to you? That would be lovely to hear.
So, hi, I'm a graduate student at Georgia State University. I research child maltreatment under Dr. Shannon Self-Brown. And what we look at specifically through Georgia State University is the main thing that we study is SafeCare, a child maltreatment prevention program. And that focuses on really helping parents who've already had some interaction with Child Protective Services, helping them to learn how to interact with their children in healthier ways, respond to their children's healthcare needs, and keep their homes safe for the children. So I've been researching child maltreatment for a little while, but there's a lot of areas within that field that are unfortunately very under-researched. And so I'm interested in populations that we don't quite understand as well what their needs are and how to help them. And autism within that is very important to me. I do have autism, and I've been in autism communities for a while. And I've noticed that very often people will discuss trauma and they'll discuss dissociation, but they'll also discuss that they can't really find help or support, they can't find resources, and there's not much out there. So there's a really major gap in that field that I wanted to try to address.
I mean, that's fantastic. Thank you so much for sharing that about yourself as well. So this is a very personal field for you. This isn't just an academic or research perspective. This is really important to you. I think that's great. I mean, in terms of what you're saying about the child maltreatment, there's a whole set of stuff we could be discussing about that in terms of what we know and what we don't know and how that applies. So it might be that we can come back and have some more conversations later on down the line. But thank you so much for raising this. I'm sure that there's plenty of people that watch this channel with autism that would love to actually see that there is someone here who not only understands the subject, but really wants this subject to be highlighted.
Yes, it's one of the things that's very important to me. Traditionally, a lot of autism research has been very out-group. It's been from maybe family members, from people with autism, or it's been from mental health professionals. But there's really been a push recently to get people who are autistic really involved in the field to kind of make sure research is respectful, but also to make sure that it's on subjects that actually benefit people with autism instead of a lot of theory that doesn't affect the daily lives of people with autism. The journal
sorry, just jumped in and interrupted you. Carry on, please.
Just say the journal I ended up publishing in Autism in Adulthood, they're actually kind of leading the pack in making sure that research, even if not by someone with autism, has worked with autistic people to make sure that it's respectful and a topic that they feel is important.
I completely agree, and I think in the dissociation circles, that's ever increasingly important. The voice of the person with whatever it is that's being looked at has to be fundamental within whatever we look at. So yeah, I think this is great, and I'm really hoping that this is a huge upward trend that you're part of. So it'll be great seeing some of the work that you've done. And some of the other information, because clearly you're very knowledgeable about what else is out there. So in terms of the work that you're currently doing at the moment, how would you sort of summarize your study on autism at this moment in time?
So what I published recently was survey data from 687 autistic adults, and it's really focused on interpersonal trauma in particular. So what I did was I gave the LEC5, which is a screening for trauma in general, but then I really drilled down and looked at people who said they'd experienced physical assault, sexual assault, or another unwanted or uncomfortable sexual experience.
Okay.
And I was actually very surprised to see that 72% of participants endorsed one of those options.
Wow.
And the total PTSD in the sample was 44%. Among those who said they'd experienced interpersonal trauma was 50%. And then dissociation was very high in the sample overall. It was higher among people who had experienced interpersonal trauma. It was 80% of participants said that they reported on the psychoform dissociation inventory that they experience either atypically high levels of depersonalization, derealization, memory alteration, or identity alteration. And then 30% also endorsed high levels of physical dissociation or experiencing mental distress as physical health symptoms. And
those are terrifying numbers. I mean, those are really high. I mean, we're talking sort of 72% is one. I mean, so the level of trauma that people with autism are experiencing is enormous. And the 687 people, that the adults that you saw with autism, were they sort of recruited from mental health facilities or clinics or anything like that? I mean, how did you recruit those people?
I turned to autism organizations. There's actually an organization called Aspire, which one of the things that they do is they help to partner autism researchers with people with autism to make sure that their studies are going to be respectful, but also to kind of help them to recruit. And then I also turned to forums for people with autism, including Wrong Planet and Autism forums. And then there's some Reddit communities for people with autism, and I advertised there as well.
Then the people that were part of the study were pretty much just a broad section of people that are in the autism communities that have links or are online or like, just being out there in the world. These aren't specifically anything to do with trauma. So this is a really broad cross section of people, and the results demonstrated those kind of numbers.
Yes, that's correct.
Gosh, I mean, it's yeah, I guess. Well, we'll dig in a little bit in terms of some of the reasons for that in a little bit, because I'm sure that you've sort of worked out and you've spoken to people and you have an understanding of this. Did you find anything in terms of maybe it's something obvious like gender differences, or where there's anything sort of specific in terms of that broad section of people?
Yeah, gender differences ended up being really the biggest predictor that I looked at. There was overall women and gender minorities reported higher levels of trauma and higher levels of PTSD, but this really came down to differences in experiencing sexual violence. Physical assault didn't really differ between the populations, but sexual violence was much lower for the cisgender men compared to the other groups.
And did you have a sense within that as to whether that violence was from childhood or in adulthood? Was there anything that you were able to sort of differentiate in there?
I didn't ask within this study, but that's really something I'd like to look at in the future.
Okay, so a good research question coming up, because I suppose in clinical work, a lot of the dissociation we're seeing is emerging from childhood. I guess it would be fair to assume that quite a lot of that may have taken place early in life, but definitely something to sort of look into. Okay, that's a really good point. You clearly there are other studies. I mean, the email that you sent me was amazing. I mean, it was amazing in terms of the detail and the content of it. I think it's very sad hearing some of those statistics that came out purely around the level of trauma that's being sustained. Are there any sort of we'll list all of the studies that you sent me in the description, so with links to where those can be accessed. Is there anything specific about those studies that you think you'd like to talk about a bit more today?
Yeah, I mean, the main thing is just acknowledging that some of them exist, because on dissociation in particular, there are very few studies. Most of them look at children and focus on just anxiety screeners saying that with anxiety, depersonalization, derealization are possible reactions, or somatization is higher. There's actually a study this month finally looking at somatization symptoms in adults with autism and linking it to more increased difficulty identifying feelings and really sensing that there's something emotional going on to begin with. But there's still not really as much out there about getting at psychoform dissociation in particular, and there's not very much looking at the link between trauma and dissociation. And then I suppose the other thing to address is just the trauma itself, which thankfully does have a lot more research behind it. Until recently, most of this research was specifically on children with autism, and a lot of it's on bullying and peer harassment, but there's also studies showing that child maltreatment is much higher among these populations, and even conventional crime, because children might, as part of the bullying or even just trusting the wrong adult, not being able to recognize when someone's a predator, these rates are just very, very high, especially if the person has the co-occurring intellectual disability or behavioral health issues. More recent studies are showing a lot of these trends carry into adulthood. So there's increased likelihood of being assaulted, of getting into a relationship with domestic violence, of being harassed or isolated by peers, or unfortunately also being harmed by caregivers, especially if someone's really dependent on caregivers for tasks of daily living. It's a very vulnerable situation to be in.
Right. So purely the sort of the nature of how a person's grown up, the things that they've gone through in life can actually predict whether those are patterns that might sort of just continue taking place throughout adulthood. And the vulnerability. So some of, I suppose, to sort of clarify, when we're thinking about people with autism in this, are we looking at the sort of like the very, very wide spectrum of autism? So some people are very disabled and have a lot of intellectual disabilities, and some might not be disabled in that level, but communication or emotional processing. So we're looking at a very, very wide spectrum of people here with this effect?
It's actually really one of the kind of horrifying implications of my study, because it was an online survey. I got people who were able to communicate online, who were interested in participating in research, who were able to read and understand the study. So the actual statistics might be even higher if it was able to include people who are nonverbal, who have an intellectual disability, who are very isolated, who don't have the ability to really understand what I'm asking about, or who are so dysregulated they can't participate in research about it. So it's these really, really vulnerable populations that we're not even able to reach, and so we don't necessarily even know what they're experiencing to the full extent.
I think that's a really important point, because what we're looking at with these terrifying numbers is actually these are the people that are cognitively and mentally able to be able to express themselves in the world, and yet all of this is still happening in their lives. So, and yeah, absolutely, there are a huge proportion of people that I guess just wouldn't have the ability or the opportunity to be able to talk about what's going on for them. So we would be reasonably assuming, I guess, that some of those figures would be really worse in terms of if we were able to add those in.
Yes, and one of the things I'm really, really hoping is raising awareness of these issues, getting more people interested in researching it, and really getting clinicians on board will help to allow for more screening to be done, for more populations to be examined, and to really allow us to get a more complete sense of what we're looking at, what the vulnerabilities are, what traumas specifically are being experienced, and then ideally how we can start preventing these from happening, addressing the actual root causes and risk factors that lead to that vulnerability.
And I think you've done a really good job in sort of highlighting the way that pattern can form. So we're not thinking that a person with autism may have had some really negative experiences, say within the school system, within education, lots of bullying, lots of maltreatment, and then gone into adulthood and everything is fine. This is pointing that those patterns can occur and are occurring a lot throughout adult life. So this isn't just, oh, it happened a long time ago, you're fine now. It happened a long time ago, and that may have set a pattern or a way of connecting to people or being vulnerable to people in adult life, which could potentially go on for years and years, and that might not actually stop unless there are good interventions.
Yes, that's correct. And it's kind of escalated because a lot of people with autism, there's so much emphasis on just addressing the symptoms of autism that there's often not really, with autism, it's hard to pick up social cues and understand how relationships are supposed to work. But when there's only an emphasis on the person with autism and how they should act in relationships, there may not be enough attention paid to teaching how to have healthy relationships. So that's a huge vulnerability for predators.
Sure. And I suppose within the mental health system in the UK, we do see there is a sort of a differentiation in terms of the condition. So someone with autism would be seen as being within services specific to autism. Someone with trauma might be in sort of a more classic mental health. And actually, it might be difficult for a person to get the mental health treatment with autism because you might be in the wrong place.
Yes, that exactly. It's all so segregated that there's often just a focus on autism. And so the trauma is not even being seen, much less addressed. And so it just keeps happening, or they just keep suffering from it.
Yeah. So it's definitely, we have to, well, I suppose we're looking at autism and dissociation. These are both things that we have to address, both independently. We have to understand the nature of how those things can be affecting a person's life, given the vulnerabilities. But at the same time, what's the overlap? So we have to sort of see that the autism, the trauma, and the dissociation are all happening in one place. But maybe our services just aren't set up for things like that.
Yeah. One of the greatest goal for me for my study is reaching clinicians and encouraging them to screen autistic clients more for a history of trauma, for post-traumatic stress, for post-traumatic dissociation, or other post-traumatic symptoms. And so, I mean, again, the goal for me is really for these people to actually receive the help that they need. And so I think bringing attention to this issue is a really important first step in that.
That's wonderful, Katherine. Thank you. And with trauma, sort of putting maybe the dissociation to one side for the moment and thinking about that trauma, is that a more popular field to look at autism and trauma then? So the studies that you've shown on PTSD and the different levels, is that more accessible for people, not the dissociation side, but maybe just the trauma?
Yes, thankfully there is a lot more research in that area. As I said, there's a lot for children specifically. There's getting to be more research on adults, and there's also, thankfully, research on risk factors that are unique to autism, both in increasing the risk of trauma, but also in the increasing the risk of PTSD, which is really the other side of things, that someone who experiences trauma, the more autistic traits they have, and especially if they actually meet the criteria for autism, they're more likely to develop PTSD from it. Because
so what's that about then? I mean, why would people with autism be more likely to experience trauma then? What's going on there?
One of the main things seems to be lack of social support and the ability to form relationships with people who are able to really step in and help them to identify red flags, to understand that the situation isn't their fault, to get support services. But it's also things like people with autism often have trouble regulating emotions, understanding situations, adjusting to new situations. So it all makes it much harder to understand the situation and to adjust emotionally. And then there's often a lot of aggravating factors like non-traumatic stressors, like financial difficulties, or just difficulties moving through the world as someone with some sensory processing difficulties, feeling alienated by peers, and all of that can really take a trauma response and really complicate it and make it much, much worse.
And that I think that was something that I mentioned in the autism video, that certainly in conversations with people, is that the world itself that can be traumatizing with people with autism. So neurotypically, someone like myself can just wander out into the world. It's more or less designed for someone like me. I mean, I'm a white male with a good education, so the world is kind of like just there for me to pick up. I suppose with people with autism, the potential for trauma then sits all around. And as you're saying, the ability for them to be able to express the meaning of that and the experience of that is much harder as well. So it's a double-sided problem for those folks.
Yes.
Because obviously you're in the academic world, I'm much more in the clinical world at the moment. What would be, is it thinking about the way that autistic people experience trauma, is there any advice that you could give me as a clinician that would be sort of almost immediately useful in terms of like my week ahead or my next couple of weeks ahead with people, given that there will be some folks with autism arriving in the clinic? What advice might you give me to be able to try and help this somehow?
Well, immediately, again, comes to mind is screening, is just helping to open up this conversation, because it's difficult for everyone to talk about trauma, but for someone with autism in particular, especially if in the past they've had their concerns brushed off, or they've been told that they're exaggerating or making a big deal about nothing, or they've been manipulated into thinking it's not something that they're supposed to talk about. And having a clinician open that conversation and help them to understand that it's okay to talk and to get help for what they've experienced could be really, really vital.
It's our role then to provide that platform, to be thinking, sort of have that sense that it's entirely possible that this person may have experienced something. I mean, certainly in terms of the high percentages you've been talking about, it is really likely then that they'll have experienced something. So
Yes.
not thinking too much, well, putting the appropriate balance between the autism and the possibility of what that person's gone through. Because I hear a lot when people are saying, yeah, I was bullied through childhood. And you, in some respect, in the assessment forms, you go, okay, so yep, you got bullied. What was that like? But don't necessarily then think, well, I wonder if it's to the level that we'd be thinking about PTSD or complex dissociation from. And I do wonder with that, whether on a clinical level, we're good enough at being able to think in terms of PTSD for those things. It's because I suppose in terms of neurotypical experience, some of those things, they happen and then you move on, and it's that sense that these are sort of aspects of growing up, but then you get bigger and you get stronger, or you get more money, or you get more friends around you, and that stuff just stops happening. We're not really seeing that in this group of people then.
Yeah, that's really another aspect of it, seeing how long it happened, how many peers were involved, was there support coming from other angles, were people who are supposed to be stepping in, like caregivers or teachers, were they enabling it? Were they blaming the autistic person? All of those can make the situation much, much worse, regardless of the objective level of the severity of what the peers are doing. There's so many factors that can really make the situation so much harder for the autistic person.
I absolutely agree. And I wonder if things like shame and just that the fear of being able to talk about these things because of being blamed, maybe, that, well, we should have done something about it, or you should have told somebody why. I mean, I suppose that's one of the big questions coming out of a lot of trauma is, well, why didn't you tell anybody? And I think you're explaining the reasons why people aren't able to, because sometimes they may not even realize how bad that experience is for them. Their understanding of intent, what it is that they are able to understand that is what's happened to them just might not be all that apparent. It's a powerful message to be able to say that we don't, the factors that we would understand from an obvious trauma level, say childhood abuse, childhood neglect, physical abuse, domestic violence, drugs and alcohol within the home, all of those factors are very, very easily recognizable. They don't have to be present within the world of someone with autism in order for them to experience trauma to the degree that they may need dissociation as a coping strategy.
Yes, I agree with that. I do want to kind of stress again that unfortunately, even like traditional child abuse really, really is escalated within these populations. And unfortunately, there's professional organization kind of implies the child's fault for being a stressful, difficult child. And so that can make it, even if the child's not aware of that at the time when they grow up, or even just getting that kind of implicit message that it's the child's fault for being too difficult, their parents kind of have to physically restrain them frequently, or that their parents are right to ignore them or to blame them for a failing marriage. All this can be extremely difficult for a child to understand, to make sense of, and to emotionally process.
Especially if we've got kids that are not being diagnosed with autism at any point in their childhood. I mean, I know that in terms of some local services around myself, that the adult diagnostic services, the waiting lists and the queues are huge. So there's a big demand for people. I think they're recognizing their own autism before education and before services are, and then trying to get in. But that means that they've spent their whole life being labeled as being all sorts of other stuff, but not necessarily people being empathic and saying, well, you have autism, so you need extra help. I guess these people have been ignored a lot and then blamed.
Yeah, it's kind of a double bind, because sometimes when someone is diagnosed early, then everything that goes wrong in their life is blamed on the autism. They're pathologized, their basic ways of communication, their movements, they're taught that all of these things are just inherently wrong and part of a disorder and something that need to be gotten rid of. But on the other hand, as you said, when someone doesn't have the diagnosis, then they may be blamed but not even have something to attribute it to. And there's also it needs to be acknowledged that there's this really big gap where the people who are less likely to be diagnosed are often minority races or ethnicities. They're lower socioeconomic status, in a lot of cases women, gender minorities. So it's these groups that already have all of these stress on them. They might be more likely to be blamed in school systems for not being able to function academically as the school wants, for not being able to connect with peers as the school wants, and all of these things are being blamed on the child instead of being recognized that they've got a disability.
Which really does come across like a whole load of barriers preventing someone actually getting any help and just trying to figure it out on their own. So yeah, what you were saying before about screening. So do you think that we need to get better at screening for both for the autism and the trauma?
Yes, absolutely. Especially again for minority communities, because there's just such a disparity right now, and they already have so many barriers set against them. This really shouldn't still be one of them.
Yeah. And you mentioned about the high rates of things like depersonalization, derealization. So I suspect in some of the symptoms of dissociation that we see, it might be hard to actually differentiate which bits of that is about the autism and which bits of that is about dissociation related to trauma. Have you any ideas how we can kind of get around that or figure that out, or be a little bit more precise about how we can understand that?
It's actually something I'm very interested in looking at, and it was one of the things I hoped to kind of look at with my original data. But I did end up asking at the end of my survey for people with autism to tell me in their own words what they attributed their dissociation to. And it seems almost in some ways there's an intersection between the autism and the trauma, and that one of the things that keeps coming up was when there's such a pressure to present to someone that the person isn't, and when they've got pressure from authority to present to someone without autism. And it's just a lot of confusing, conflicting demands on the person, demands for things that don't come naturally. Right. All those can be difficult situations to begin with, and it can also kind of almost encourage depersonalization and being disconnected from who you are. And then I guess from a more purely autism angle, a lot of people describe experiencing derealization when sensory processing causes problems, when someone just feels so overwhelmed they almost can't remain grounded in their body and also function in the daily world.
Are you saying that actually some of the difficulties that people can have with autism, the challenges that they face and the limitations that the autism places on them are pretty much dissociative symptoms in a way?
Yes, a lot of people really, really describe their symptoms in that way, that they almost don't even draw the distinction because it's so inherent to how they cope with their autism, or it's just so inherent to one of the ways that autism interacts with.
Makes me sort of wonder, and certainly labeling can be difficult, and sort of like putting those labels, okay, that's depersonalization, that's derealization, for example, or somatization, conversion type things. But actually, this is the everyday experience of that person's life. This isn't a symptom as such. This is how they go through life, everyday experience.
Very often it seems to be, yes.
It sounds very much like we need more time to truly understand things from the person's perspective. So not really just to jump straight into, the collection of symptoms and kind of maybe hitting those DSM inventories, but actually to spend the time working with that individual to give them the space to express their life experience. So try and understand it from their point of view. It seems like the most obvious thing that we should be doing as far as our clinical work goes, but my worry is that clinical services are constantly being hounded to try and reduce the amount of time that people get. And my worry here is that actually people that need more time to be able to find the words and to be able to sort of demonstrate what's been happening for them and their perspective on it, that's becoming harder and harder to achieve in our mental health system. So I think what we've got then is there are clear vulnerabilities with people with autism to picking up traumas along the way, and that some of those traumas aren't necessarily going to be the obvious barn door traumas that we would see in folks maybe without autism or within very clear-cut histories. So they're much more subtle, much more sort of pervasive, everyday problems that people are experiencing that are going on and on and on, that are developing to the level where they would be considered for PTSD diagnoses, complex trauma diagnoses. And there's the difficulty in actually being able to express and being able to share those feelings or even recognize what's going on.
Yeah, and as you said, all these really just compound to increase the vulnerability to where you're reaching the point where you're getting 72% of the sample reporting flat out assault or uncomfortable sexual experiences. So just when they don't get support, it's such a big vulnerability.
And I think it's a very powerful message because sadly, because the numbers are so strong. I mean, these are undeniable numbers this is a large group of people. They self-selected to take part into a study from all walks of life, and yet these figures are showing that these traumas and the more likely dissociation effects that are taking place are happening all across the board. Was this largely the group of people? I know because it was an online thing. Was it largely US citizens, or was this something that was a little bit more global? I mean, how likely might we be to think the same was happening, say, here in the UK?
My study specifically, I did not ask about country because with the sensitivity of data, I wanted to minimize the amount of potentially identifying information that I collected. I can say that I'm aware that one of the group of researchers who's looking at trauma and autism is actually based in Israel, and they're getting very similar numbers to what I'm seeing here. And another group I'm aware is in the UK. So it does seem to be, if not global, then it's very widespread and international.
Which would make sense given the sort of the similar sort of figures we've had on the screening for dissociation, whether it's in the UK, whether it's the States or Greece or Germany, Turkey or Israel, for example. These are countries where we're seeing the same sort of prevalence rates for dissociation. So it very much sounds like your study and the work that you've been sort of putting together and following is on those same lines. So this is a global issue.
Yes, unfortunately.
Yeah. Well, this has been absolutely fascinating, Katherine. Is there anything else that we haven't touched on in the interview today that you think you'd really like to be able to get across to the folks watching this channel? Some with autism, some without autism. I'm sure they'll all have an interest in this. Is there anything else that you'd like to add before we draw things to an end?
One of the things is sometimes people don't necessarily understand why there has to be research on a topic specifically, because this is something that autism communities report so frequently. Sometimes people wonder why it's not just enough that this is something that's being reported. So I guess I really want to stress to those people that, and this isn't really just something that individuals need to be looking at. This isn't just something we want individual clinicians to be seeing and changing in their own practice. This is something that we want people in positions of authority and power who can actually make big systemic changes. We want them to be aware of it. And for that, we really need data, not just on the frequency at which this happens, but which people with autism are the most vulnerable, what types of trauma is happening the most, what type of trauma is having the most impact, what are the outcomes that we need to be on the lookout for. And all of that we really need to do by getting research from diverse populations and large populations and approaching this from many different angles.
I completely agree. I've done some studies. One of the other videos is around sort of the impact of sort of therapy and how you can actually reduce the costs to the health economies by actually addressing some of these. I think what you're raising with your work is this sort of systemic, lifelong developmental pattern that even if we take away the experience of the people with autism that are actually going through that, and we just think in terms of the economies, the cost to services, the cost of sort of maybe unemployment rates or relationship breakdowns, all these sort of things, it's got to be absolutely vast.
Yes, and ideally in the future, as I said, I mean, right now we're looking at identifying what's the problem, who's experiencing it. Ideally, if we keep progressing with this, we can really hammer home on the risk factors and start identifying children who are at risk before they have these experiences and intervening really early, not just to address their personal risk factors, but also environmental risk factors, peer relationships, home environment. So it's really prevention that's the ultimate goal.
Yeah, which we know. I mean, that's the thing, don't we? We know it just doesn't always feel that there's enough being done about it. And I agree. That's where the research comes in, because it isn't about an individual saying help. It's about hundreds, maybe thousands of individuals coming together in a very coordinated, very well organized study, demonstrating that these are figures that cannot or should never be ignored.
As individuals, it's often easier for us to look at addressing it after the fact, because I mean, as a clinician, you have the opportunity to help people who've actually had these experiences. I guess my role as a public health professional is to try to really hammer home on what we can do to prevent these experiences from happening. And it's much, much harder for any one individual to have any influence there. So it's really what we're trying to do is figure out how to change the systems, just the entire broader context that are leading to this happening in the first place. And that's going to be very much so a long-term effort, but it's very important that we do what we can.
And I think that's a lovely point to close on, because that's exactly what we're doing here. I mean, I'm working as that clinician. I've raised some issues based on my clinical work, which is the individuals coming through, highlighting something. You've picked up on that. You've got in touch. We're doing the opposite of dissociation. We're associating with each other. So I think that's been absolutely wonderful that you've taken the time and put so much effort into getting in touch and wanting to share this, because we have to work together. We have to collaborate, though a lot of the work in the clinical field comes from the academic research. That's how we get our evidence. That's how we understand what best practice is. We rely on folks in your position to spend countless hours being able to go through the numbers, speak to people, and put these studies together. And I'm so grateful that you are willing to spend so much time and effort into sort of bringing this to my attention, because that allows us then to broadcast it, hopefully in this channel, to as many people as we can do. But also in the clinical practice, this is something that I'm definitely going to be thinking much more about and learning from this conversation about what I need to pick up on, some of the questions I need to ask, and spend more time on that detail of that person's experience. So hopefully we're able to do some really, really wonderful things and change as much as we can do that needs sorting out.
Yeah, I really appreciate this opportunity, because on the flip side of that, a lot of the times what happens in academia kind of stays in that academia bubble.
Yeah.
And we're trying to disseminate better, but this is a much better opportunity than anything I've come across on my own. So I really appreciate you giving me the opportunity to try to reach people with this information.
Well, thank you, Kat. It's been a lovely way of learning about research. So it's been an absolute pleasure talking to you, Katherine. From everything that you've put into this, I think from all the people on the channel and all the people with autism that we work for, I'm sure there's a huge amount of gratitude. As always, I sort of say at the end of these videos, if people are willing, like to like and subscribe and leave some comments, and I think I'll let you know. And I think one of the things that I'd like to be able to do, especially with developing a new website, is maybe be able to sort of put some of this research on the channel, but also on the website, so people can find the links and they can go and do some of their own reading.
Thank you so much.
Absolute pleasure, Katherine. Well, enjoy the rest of your day, and I'm sure we'll be speaking again soon. Thank you so much.
Enjoy your day as well.